Hi everyone, I hope you all are doing well. I want to apologize for not doing any videos last week, even though I said I was. I haven't been doing too well. I do want to eventually get to the EDS video this week, but today I'd like to explain what it is that's been causing my problems and it's kept me from doing my videos. For about 6 months now, I have been suffering from something called dystonia. Dystonia is defined as a neurological movement disorder in which sustained muscles contract, causing twisting, repetitive movement, or abnormal posture. Now, the reason I know that it's dystonia is because I had a severe dystonic reaction to compazine back in 2008 when my gallbladder was removed. It was like 3 or 4 days after I had my gallbladder removed. I was taking compazine to prevent vomiting, and all of a sudden during the day I felt like I had to stretch my neck. Like it kept moving this way, and it just felt like this whole area needed to be stretched. And then all of a sudden my mouth was starting to tighten up, and I was moving it just kind of like side to side to try and like stretch that part out. Before I knew it, I was stuck in a position like this with my mouth and jaw clamping shut, and then it would open up every once in a while and it would clamp shut again, and I actually chipped teeth from this event. It was horrible. I was in so much pain. I was throwing up because when I'm in a lot of pain, unfortunately vomiting is one of the things that I do. I couldn't lift my head up off my shoulders, so I was literally like this with my jaw clamping. It was so painful. I get to the emergency room, and the doctor looks at my list of medications and goes, "Are you still taking the compazine?" And I said, "Yes." And he goes, "Well, this is a 1 in a million adverse reactions to compazine. It's not very common, but because it does happen to 1 or 2 people every once in a while, I don't like prescribing compazine." So that's the first time that I got Zofran. It was horrible. It was so painful. I was crying. Like I said, I chipped teeth. It was just beyond painful. They gave me pain medication and Benadryl, and they had me stay on Benadryl around the clock for 24 hours to make sure that all the compazine was out of my system and I wouldn't start reacting again if I stopped the Benadryl. So in November I had my adrenal crash. My body just crashed on me because I had undiagnosed adrenal insufficiency, and not only had I just flown back home from North Carolina, but I had a cold, and I was having a gastroparesis flare-up, and I also saw my geneticist, who did a physical exam on top of like a 2-hour appointment of talking to him to be diagnosed with Ehlers-Danlos syndrome. After the appointment, we got to the car, and I pretty much looked at my mom and said, "I don't feel good," and passed out. It turned out that I was having what they call stress seizures. They show up on an EEG, but they don't require medication like epilepsy does. I'm hoping to do a video in the future explaining everything that happened, all the testing I went through, and all the symptoms I had for my adrenal crash. But after I got home from my adrenal crash, I was exhausted, and so I didn't do much the first couple of weeks. And then one day I decided to go to Target with my mom. And then we got back home, and I started shaking. And it's a really horrible feeling. I could start to feel my muscles contracting. And we thought, since I had only been home for a little while, there that it was related to the adrenal crash, and as soon as my body was back up to full strength, that I should be fine. In January, they started getting worse. So I finally made an appointment with the neurologist to go in and see them and talk to them. It gets to the point that if I clamp my hand shut on myself, my mom is unable to open my hand. She fights me every time to open my hand so that I don't end up cutting myself with my nails, or I don't end up, if I have my hand in my arm, I don't end up bruising myself. It's just not a fun situation at all to be in. So, it has started increasing from days that I had, done a lot of stuff to now almost every single day. So we went to see the neurologist. I even had an episode while I was at the neurologist's office, and one of the neurologists saw me. And the way some of the appointment works at U of M is they have the doctor that sees you, and then the doctor's boss, the top doctor, will come in and evaluate you too and talk to you. So we went through everything with the neurologist. He went and got his boss, and she looked at me and said, well, this is all being caused because you are on pain medication, masking all your pain, so your body is trying to tell you it's in pain. If you get off your pain medications and go get cognitive therapy, you will be fine. Cognitive therapy means psychiatric help. And I looked at her, and she could tell I was upset, and I was like, this isn't caused by my medications. I've had a dystonic reaction before, and it feels like exactly the same thing. And she's like, well, what do you want? You came here for an answer, and I'm giving you an answer. It's because you are on pain medications, and you need to get off the pain medications and get cognitive therapy. And I looked at her and I explained, I said, I've had surgeries and never taken pain medication. My OBGYN made, had a laparoscopic surgery, which means just 4 tiny incisions. She actually only did 2, but to remove my endometriosis. I didn't take any pain medication for that. And I'm sitting here and telling the doctor, I don't like taking pain medication. And I only take the pain medication because I have to be on my feeding tube 24 hours a day. And I have what's called visceral hypersensitivity, which is overactive nerves. So running my feeds hurt. And I told her, I said, I don't take more medication than I need. If I don't feel the pain, I don't take it. But the pain medication itself is not masking all my pain. I'm still having pain. So your theory is just, it doesn't validate itself. And she looked at me and she goes, no, that's what it is. She goes, we'll admit you for a long-term EEG. It could be about 3 days. It could be longer if we need to. But, I'm pretty sure that, we already know the cause of it. So I left that appointment almost ready to cry. They admitted me for my EEG, and of course, I had 3 episodes throughout that night. The first episode, I had to suffer. The second one, the doctor wrote for Ativan, and apparently he only wrote for the Ativan for 1 use. So I had a 3rd episode, and I had to suffer through that too. And, they weren't giving me all my medications. They were only giving me my Zofran, and that's about it. They didn't want me on my pain medications. I think I got my pain medications after I had the episodes. And I actually went home the next day since I did have 3 episodes. They pretty much got all the information that they needed. And of course, the EEG was normal. So the neurologist that works at the hospital, after seeing the neurologist that I saw and seeing her notes, he told me the exact same thing. And, I told my mom, I said, I feel like she looked at my chart, she saw that I had methadone, and she saw that I've also been written Dilaudid before for breakthrough pain, or before I even started the methadone, I was on Dilaudid for about a month. And she just wrote me off as someone who's on medications, and that was it, not someone who has physical problems. I mean, it could be related to my Ehlers-Danlos syndrome, it could be related to dysautonomia, it could be related to, lack of nutrition from my gastroparesis, who knows. I was just written off. So, I informed my gastroenterologist, and he was shell-shocked that was the answer that I was given. And he wrote an email to the doctors while I was in the office with him. At this point still, though, we have no clue what's causing it. My pain management doctor wanted me to stop the Tygan that I had, and I stopped it for just about a week and a couple of days, and because that medicine does not last in your system a long time, and it never stopped. So we know it's not the Tygan. We don't know if it's related to the hydrocortisone that I'm on, the steroid that I'm on for the adrenal insufficiency. But most of my other medications I've been taking forever. And for it to get this bad, it's hard not knowing what it is. I get at least 4 to 5 episodes a day. Some days are worse. Some days I can get anywhere from 10 to 12. But it's hard. Episodes can last up to 30 minutes. Literally my body, all my muscles will start to contract, and I'll start to twitch or shake, or you can tell that all my muscles are contracting as hard as possible just by my movements. My parents don't want me home alone, and I understand that because I don't want to be home alone when I'm having these episodes, because I can't always get up and get the medication to take to help me get through it. Right now we are using Xanax to try and get the to get that episode as short as possible, and typically it will work after about 5 minutes or so, but that's not a long-term solution, or if it is, I need to find a doctor to continue prescribing it once I'm out. But it's been pretty hard. It becomes pretty painful. I've grown some muscles since I started getting them, which is, I guess a benefit from it. But that's one of the reasons why it's so hard for me to get on and do the videos as much as I want to do them. Dystonia is taking everything out of me, because when I have an episode, I become exhausted. And so it's okay, I had an episode, let me lay down for an hour, and then I can get up and do my video. And by that point, either my gastroparesis is making me not feel good, or I had another episode, and, it's just a huge circle that it keeps on going and going and going. I really want to do these videos, and I really want to answer as many questions as possible, but that's why sometimes I will go an entire week without it. In April, I will be getting admitted to the hospital, to a different hospital than I usually am at, by my pain management doctor. He's going to be taking me off my methadone and putting me on a new medication. And the reason I'm being admitted is because he admits all his patients when he does this, but they use a PCA, which is a patient-controlled pain pump, to try and minimize withdrawal symptoms, because mentally I'm not addicted to my methadone. I don't have to have it, like, for my body, but I unfortunately have to have it to be able to run my feeding tube. But, I've been on it for over 6 months, so my body has developed a dependency on it. So once it's completely stopped, I will probably have to deal with some withdrawal symptoms. So being admitted, they can help try and reduce those withdrawal symptoms as much as possible. Like I said, with the pain pump of a different narcotic, probably more than likely Dilaudid, because it's one of the stronger ones, anti-nausea medications, things like that. And then they will be testing my blood daily to see how much of the methadone is still in my blood. And once the methadone is out of my system, then we can stop the pain pump and we can start the new medication. I will do my best to, to give you guys an inside look as to how it goes. Whether I record a video or I make a post on it, I'm going to do my best just to log everything, and let you guys know how it is. And then once I'm on that medication and it's been long enough to actually work, I can let you guys know if it works. It's called buprenorphine. It's the same thing that's in the Butran patches, but I'm going to be using it sublingual, which means it goes under my tongue and gets absorbed in your mouth. And eventually we might work our way up to the patches. Just depends on how it goes with the sublinguals. But I will document my whole experience. I'm really concerned about going to this new hospital just because I am so complex. Between my my visceral hypersensitivity, my gastroparesis, EDS, and especially these episodes which we have no clue what they're from. Both me and my mom are just really concerned that they're not going to know what to do to handle me. But, I'm ready to change my medications, ready to see if it'll help me. The pain management doctor, said that if I have an episode to call in a nurse. There's usually a doctor always on the floor, because of what they're doing with the withdrawals and the changes in the medications and stuff. So he said, when you have an episode, I'll take a look at it, see what's going on, see what it could be, or at least help you medication-wise to stop it. So I have faith that, the hospital experience will be good. Fortunately, I'll have a private room, but I'm still just worried about my dystonic reactions. Nobody's been able to tell me what it's from. Nobody's been able to tell me how to deal with them. I've tried ice. I can't do a heat pack because thanks to dysautonomia, I actually have really bad heat intolerance, and if I get hot, which I very easily do get hot, I will physically get sick. So we've tried ice. We have tried, my mom has tried to massage some of the muscles, but unfortunately it's my entire body, so she can't do it all. We've tried the Xanax, we've tried Benadryl, we're doing everything that we can. So, I hope, on top of giving you guys an insight look as to what's going on with me, that you guys have learned a little bit more about what dystonia is, in case any of you are on compazine and have that reaction, or if you have a reaction to any other medication and it is a dystonic reaction. That way you guys know what it is rather than sitting there for hours and hours of testing on end and not knowing what it is, you can tell the signs and symptoms of dystonia. A lot of the time, it can make people move and put them into like a really weird position. Like I said, when I had my reaction to Compazine, I was stuck like this. Now the dystonia reactions I have, it's usually my arms that get stuck in a weird position. And which is why I usually try and cross my arms to prevent that. But because I had that reaction to to Compazine, I can't take Phenergan because they're very similar medications. So if you do have a Phenergan allergy, then Compazine is probably not something that you would want to take as an antiemetic. There are a ton of antiemetics out there. Some really old ones that they don't use anymore, because currently the common ones are Phenergan and Zofran. Compazine was the common one a few years ago, so they still throw that in occasionally. I use myself Zofran and Tygan. And Tygan is a really, really old antiemetic. So old that when I had it in the hospital the first time as an intramuscular injection, I had them put it in my arm because to me it's just another injection. Well, none of us knew how much the Tygan burns and stings and how thick it is. So it burned when she put it in, and I didn't think very much of it, and then about a minute or two later, my arm, the area where she injected it, it became about this big right here, swollen. It was rock hard, and my entire arm hurt. I started crying, I started cussing, and I looked at my dad and I said, you need to grab my arm and you need to start moving it so that it gets out of that area and it gets into my system and the pain will not be as bad. And he had to sit there and he just grabbed my arm and he started going like this to move it for about 20 minutes, I would say, before it finally became enough that I could handle it. But it was still rock hard, and for about 2 days my arm hurt. So if Tygan is something that you're looking into, they do have a pill, a capsule version, but that didn't help me much at all. If you do the intramuscular kind, just be very careful. Make sure to put it in a fatty area. If you're skin and bones, then use your upper thigh or your butt, because otherwise you will regret it. So I hope that, I know I went on a sidebar a couple of times, but I hope that I have helped you guys out a little bit, giving you a sense of what dystonia is and how debilitating it can be for some people. And hopefully you never experience it, but if you do, now you know what it is, and you can, figure out yourself, okay, this is a dystonic reaction. Is it caused by a new medication that you're on? If not, then that's something that needs to be looked into. If it's caused by medication, use Benadryl for 24 hours, and the Benadryl should help you get through it. Once I had the first dose of IV Benadryl, it stopped my reaction, and so I just had to put an alarm on so that I could have my Benadryl I think they had me doing it every 6 hours for 24 hours, and I made sure not to be late so that it wouldn't start up again. If you guys have any questions, please feel free to let me know. You can post them or you can private message me. If there's a topic you guys want me to talk about, let me know. I hope you guys are all having a wonderful day, and I will do another video later this week. Thank you.